request Dr. Silvia Di Rocco from M.P.R. International School from Switzerland to join the event as one of the keynote speakers for the event.
Hello, how are you? Can you listen very well?
Yes, sir, it's fine.
Okay, thank you so much. Thank you for your invitation in this important meeting. I'm very glad to participate in your meeting, and I will try to share the presentation of M.P.R. The topic of today is the M.P.R. Rehabilitation. And if you like, I can start with the presentation now. Okay?
Yes.
I will try to share my screen, yes. I will try to share the screen of the presentation. Let me 1 second. And I will share the screen now. Okay. Let me 1 second because it's not allowing me soon to do that. Let me. I don't know why it's not allowing me to share the screen. Okay, now it's sharing. Okay. Okay, wait a second. All right. All right. Are you seeing the presentation now? Yes. Okay.
Yes, it's fine. It's fine.
Okay, thank you so much. Okay, I will start the presentation regarding the M.P.R, the myofunctional postural rehabilitation. And it will be an introductory presentation, yes, regarding our protocol in our school. I tell you, I am the director of the M.P.R International School, yes, and it's for me a pleasure to be there with all of you, and I'm very glad to participate in that particular meeting, yes. And the M.P.R is a method, as you will see in the presentation. It's a short time to do the presentation, but I will try to do the presentation in a short time for all of you. Okay. All right. Then the M.P.R is a particular method that I invented many years ago. And this is my CV. If nobody know me, you can see my CV there in the presentation. And the M.P.R was born many years ago to help the medical science to work together. That was the meaning many years ago. And I will try to explain the concept of this method. M.P.R is part of the integrated interdisciplinary protocol. I will try to explain in a short word what is the concept of the integration in medical sciences. In our school, who is an international school, we teach people all around the world, in America, Europe, and Asia, with this protocol. And it's a very simple and effective protocol, and you will see in this presentation the main concept of the myofunctional and postural rehabilitation. When we're talking about rehabilitation, is a very big word, because rehabilitation means rehabilitate something to work like before. In our school, we teach all medical science professionals, medical doctors, medical dentists, osteopaths, physiotherapists, and all the disciplines to understand each other with the meaning to work together to treat the patient in the neuromuscular skeletal dysfunction. Today we will talking about 4 topics: the introduction for M.P.R, the protocol, how it is, the tools we use, and we see some patients that have to be treated with the M.P.R protocol. We're starting for the introduction in M.P.R. M.P.R is not a technique. We are habituated to work with techniques. M.P.R is a method of treatment, diagnosis and treatment for all medical sciences to treat the neuromuscular skeletal dysfunction. When I say all medical sciences, all health sciences, is because we cannot work together. We have to work in an interdisciplinary team just to work better and to have a better result. And the objective of M.P.R is to put in balance the cranio-fascial system and the rest of the body, who is the tonic postural system. Because sometimes we are talking about TMJs. TMJs is just a joint. It's a joint who is part of the cranio-fascial system. It's part of the whole system. Cranio-fascial system is a very, very important system in our body. In the cranium, there is the nervous system. And in the cranio-fascial, there is the stomatognatic system. Two important functions. And about our experience, I have 47 years experience treating patients. In our experience, is a big disturber of the postural disease. The tonic postural system is a very, very big disturber. When the craniofacial system is not in balance, it's disturbing the whole body. The craniofacial system is composed of several bones and muscles that have to work in harmony with the rest of the body. And one concept I want to transmit for everybody here and the people who are listening to me is that we cannot have balance just treating one part of the body. It is impossible. It's not difficult, it's impossible. We have to have a holistic balance to have a good result in our therapies. All these bones of the craniofacial system and the jaw, the lower jaw, is part of the craniofacial system and it's part of the TMJs also. Okay? This jaw is conditionated. The position of the jaw is conditionated by the dental occlusion, who block this position. And when the position of the jaw is not right, you will see later, it's creating a lot of problems into the postural tonic system. That means the posture of our body. A good functioning of the craniofacial system depends mainly on a balanced mandibular posture, which in turn depends on a good functional occlusion to maintain that position. The result, an optimal local and general neuromuscular balance, is to put in balance craniofacial system with the rest of the body. We're talking about rehabilitation. To obtain a good rehabilitation that lasts over the time is necessary an interdisciplinary protocol where all the health sciences speak the same language in diagnosis and therapy. That is the M.P.R. The M.P.R teaches the people to speak the same language in diagnosis and treatment. Just to work together. We cannot work together if we do not speak the same language in diagnosis and therapy. And that is very, very important to have a good rehabilitation. After the introduction, we are talking now about the protocol. As I told you before, M.P.R is not a technique, it's a method. It's a method to obtain a good result that use different techniques. M.P.R is really an integrated interdisciplinary protocol for all health sciences, so that they can communicate with each other to treat the patient with the same object. It is a diagnosis and therapeutic method which acts in physiological and natural way, and that's very important. The main objective of the M.P.R is to obtain the balance between craniofacial system and postural tonic system. When we have this balance, all the body is in health. And if we have to do a rehabilitation, the rehabilitation will be perfect. What is M.P.R? M.P.R is a diagnostic and therapeutic method that uses tools of different disciplines. The purpose is to obtain the balance of craniofacial system and tonic postural system. The objective is diagnosis to obtain the priority. Normally, when we are talking about priority, we think that is the cause of the problem. In M.P.R, we know very well that we have a lot of interferences in our body who are disturbing our posture. And the objective is to do the diagnosis of these interferences, to annulate them, to allow us to have a good rehabilitation. That is the priority. And we have a lot of interferences. The diagnosis is focused in to find the interferences, to annulate them, to have a good rehabilitation. Integration is a very, very important word in our school and in our protocol. Integration, we mean neurophysiological integration of the systems. We have to integrate the system that they are connected neurophysiologically. We cannot act only in one part of the body. It is impossible. All the body is connected. All the body is in relation. And it's very important to understand this relationship just to treat our patient. The protocol, our protocol of M.P.R is an active protocol that can be adapted in any evolution of our patient. It's integrated because the specialists intervene with the same diagnostic and therapeutic approach. And it's interdisciplinary because various disciplines working together. All medical science work together. And the M.P.R is the tool of this protocol. The myofunctional postural rehabilitation is the tool of this protocol. It is myofunctional because it's doing a physiologic neuromuscular skeletal balance. It is postural because it's doing rehabilitation of craniofacial system with the rest of the body. And it's rehabilitation because rebalance the whole system. That is M.P.R, synthetically. the action of M.P.R. The M.P.R. action is very simple and very logical. If we know we have aggression to our body, we have to take it out. And that's why we said we deprogram and reprogram sensorially all systems in a physiological and a traumatic way. Rebalance the whole body. We cannot have body rebalance if we don't treat the mind, the structure, and the biochemistry. This triangle is the triangle of health. We cannot treat the patient just treating the structure, just treating the mind, or just treating only the biochemistry. We have to work all together just to have a good body rebalance. The diagnosis in M.P.R. We do clinical diagnosis as all medical protocols. We do an instrumental diagnosis like all medical protocols. And we do the complementary analysis also like any medical protocol. When we're talking about clinical diagnosis, because we are working in posture, we study the oculomotor system, who is one of the main receptors of the posture. We study the postural analysis of the patient. We study the stomatognatic analysis, but that means craniofacial system analysis, and the foot support analysis. Clinically, we study all these things to arrive in a good diagnosis, clinical diagnosis. Regarding instrumental analysis, we use posturometry and stabilometry. We measure the posture of the body. With the measure, we are doing scientific, the clinical analysis. Posturometry and stabilometry is a good instrument to help in our diagnosis. And the analysis, complementary analysis, we study the food hypersensitivity and the amino acid deficit. Food hypersensitivity don't mean intolerances. It's hypersensibility of our alimentation. With these three clinical, instrumental, and complementary analysis, we have a global picture of the disease and we can treat our patient. Obviously, we use different tools for deprogramming and reprogramming. Different tools, and then obviously if there is a protocol. It's very difficult in 45 minutes to explain the protocol totally. But we have a protocol of action. But the tools we normally use, they are the instruments of the M.P.R. are all of them for deprogramming and reprogramming the therapeutic priorities, as I told you before. For the oculomotor system, for the craniofacial system, for the podal support, and for the biochemistry. We have tools to annulate the aggression, to allow us to do a good rehabilitation. And we have tools to reprogramming the things that they need to be reprogrammed. For the eyes, for the oculomotor system, we use simple magnetic field for deprogramming and exercises for reprogramming. For the craniofacial system, we use a very important device for all medical sciences. BED is a thermoplastic device that we teach all medical science to use it. not just dentists. All medical sciences use the body equilibrium device to annulate momentarily the aggression of the craniofacial system. And obviously, for reprogramming, we use another devices. Reprogramming is for the specialist. The deprogramming is for the whole medical sciences. We use something for the foot support. Some magnetic insoles for deprogramming and some physiodynamic insoles for reprogramming the foot support. These tools allow us to annulate the aggression, to have a good rehabilitation, and after that, if it's necessary, to reprogram the sensors. In the biochemistry, we use detoxification, purification of the body for deprogramming, and for reprogramming, and a special diet and a special treatment for the intestine, for the gut, and for the whole body. This is the M.P.R. action. This is the M.P.R. protocol. This is the M.P.R. philosophy. Before go to some patients, I want to talk something regarding the protocol. If we imagine our central nervous system as a computer, as a PC, doing some simplification, the PC have a central board that is working to do work in the computer, and we send information to the PC, and the information is arriving and the computer answers. If something is wrong or something is problematic, we have an antivirus to protect our PC. In the central nervous system, antivirus, it doesn't exist. And all the information will arrive to the central nervous system, main computer, even if it's wrong. If the information is good, the answer will be perfect. If the information is wrong, the answer will be not perfect. That's why with the deprogrammation, we put some antivirus, momentarily antivirus to the PC, annulating the wrong information who is arriving to the central nervous system. That allows all medical science to do a good rehabilitation. Imagine doing another sample. If you have a headquake who is in act, no engineer, no architect, nobody think to build the houses during the headquakes. They wait until the headquake is stopped, and then they build the new houses. That is the same in our body. If we do not stop the headquakes of the aggression to the body, our techniques for rehabilitation will not work permanent. Will work only momentarily because the aggression is still there. This is the concept. It's not one technique better than the other. I think all techniques is good in the hands of the operator that are applying it. But if we do not annulate before the aggressions, all the techniques will fail. First or after will fail. And we normally change techniques thinking the problem is the technique. We are looking for new techniques for treatment. And the goal is to annulate the aggression first. That goal we call in our school deprogramming the system, sensorial deprogramming, to allow all the techniques, all the rehabilitation work very well. When the rehabilitation is finished, you know, in the computer, it's some sensors that you have to change. The same is in the body. Maybe some receptors you have to reprogram. Maybe no. But if you need to reprogram some sensors, you have the tools in M.P.R. This is the concept for M.P.R. It's very difficult in a short webinar to explain the whole philosophy, but this is the concept. This is some patients that we can treat with the M.P.R. We normally talking about scoliosis. In our point of view, most of the scoliosis are functional scoliosis. That means adaptation to this aggression we are talking before, who is acting this aggression to the muscle chain and is creating the adaptation of the scoliosis. Just, I think, 5% of the scoliosis is a real scoliosis, anatomical scoliosis. Most of them are functional adaptative scoliosis. And if you study and you investigate the patients, you will see that it's compromised. The craniofacial system, the oculomotor system, the biochemistry, the mind, and the foot support. And the adaptation is scoliosis. As you see in this patient, has a postural disease, has a scoliosis adaptative, and the mouse. Even here, this patient who has a postural disease, postural alteration, it has a craniofacial system problem, biochemistry problem, and more than that, have a real short leg. How you can treat it? If you don't work integrated, it is impossible, believe me. In that age is when we can prevent, in this age, we can prevent the situation. In that age, early age, that's why in our school we focus in pediatricians and pediatric dentists and medical doctors, family doctors, to act in that age. Because in this age, you can prevent the future of your patient to do not arrive like this. This is not the same patient, two different patients. But if you follow the diagnosis, is the same. Maybe that patient, when she was a child, was like this. Nobody treated. And then arrived like this when he's an adult and we have to treat it. This is the issues I told you before. The jaw position is not right, mouth open and mouth closed. If you see how it's changing the posture, and see that patient, a postural problem, and after the programming, the posture was like this before and like this after, just annulating the mouth. Then she has to have the rehabilitation. The same here, the same pattern. Look at that, the same pattern. Patients with a lot of problems that normally we see partially. We don't see all around the world. We don't see integrally. And if we see in the total concept, we don't have a protocol to work together. We are only doing derivation of the patient. I send you the patient to you and you do your job. You send it to me and I do my job. But we don't talk together. We don't have the same point of view. This is M.P.R. is doing the same point of view for everybody. Look at that, postural alteration and related with also the mouse. Postural alteration here, oculomotor system alter, occlusion alteration. How we treat it? Only the dentist, only the optician, only the physiotherapist. If they don't communicate together and they don't have a protocol to work together, it's very difficult to treat this patient. This, the mouth, tongue, the eyes, alteration of the posture, and how we treat it. And also, a shorter legs, a real shorter leg. Who starts first to treat that patient? Who is the first to do the action? Obviously, if he's going to the dentist, start the dentist. If first he's going to the physio, start the physio. If he's going to the podiatrist, start the podiatrist. But in our protocol, we have a special protocol of action to work analyzing with diagnosis and therapy who have to start first, who is after, and who after. This patient with a postural diagnosis, postural alteration, this is a real scoliosis. The colon bigger than the body can allow that. This is real. And if more than this, we add craniofacial system dysfunction, oculomotor system dysfunction, foot support and biochemistry, this will be worse and worse every day. Patients, if you see, when you say postural alteration, occlusion, oculomotor system alteration. If you see there, look at that patient. That patient was doing a surgery, one surgery each year because has pain. And because the surgeon, the only tool was the surgery, was operating because the pain did not disappear. He never see the whole picture. Child with functional scoliosis, where it's also related to the craniofacial system. And the same here, postural alteration, craniofacial system, and foot support. And in an elderly lady who is arriving like this after a long time of treatment. And this is patient that was a patient that was, the surgeon was operating the patient because the jaw was no good. And look at the difference doing craniofacial orthopedics and postural rehabilitation. How it's changing? How it's changing? No surgery, just treating the function. That's why I'm saying we have to work together. That was the difference between after and before. Different patients who have problems, and we can resolve the problem in the early age. Patients who start very early the treatment with this dysfunction, craniofacial dysfunction, postural alteration, and doing one specialty which is calling craniofacial orthopedics. The changes is like this. The changes is better without trauma. But not only local, not only there, the posture also. How the posture is changed before and after the treatment. That is the goal. This patient, another patient who start very early, that is the age to do prevention, to working all together. This is a three-dimensional discrepancy of growth. Craniofacial system, very bad. The retromandibular position, the sagittal growth deficit, starting at 6 years old. And slowly, stimulating growth and posture was changing. Slowly was changing. And how is before and after, 16 years old. But we work during the growth age. We're working during the growth age, changing the situation, changing the craniofacial system, all perfect, but the posture is perfect. It's not only the local area perfect. How the posture, like this, today is like this. Like this, today like this. This is the goal, working together. And prevention, that is very, very important, the prevention. I hope you enjoyed the presentation, and a very short time is very difficult. This is our courses, no? We normally do in our school. This is the new courses we start in this year. Someone want to stay with us. This is Silverstone Company is organizing our courses. Okay. I don't know if it's any question. Tell me. If it's not, we finish our presentation, please.
Yeah, doctor.
Hello.
Yes, yes.
Hello, I am here. Hello?
Yes, yes, sir. We do hear your voice.
Okay.
See, sir, any questions?
No questions, but I just wanted to thank Professor for his presentation. It was really interesting, and it's pity that I have to do my presentation earlier because my presentation was very closely related to this presentation about temporomandibular joint dysfunction and relationship between static and dynamic balance. Yeah.
And it's important to understand that we cannot treat alone the disease. We have to work together. We have to work together, medical doctors, medical dentists, physiotherapists, osteopaths, all together to treat. We are fighting with the disease. It's a war with the disease. And we cannot win the war alone. We have to work all together. This is our school. Our school is teaching people to work together with common protocol, with a common language. We teach all around the world for all the medical sciences, teaching the concept of integration. That is our goal in our school, integration in medical science. Thank you so much for your work. Thank you so much.
Thank you.
Yes. Any questions? Any questions for Dr. Silverio Di Rocco? Thank you very much, sir. We want to compliment on your topic. Thanks for sharing your tips with us. We would like to inform you that Dr. Silverio Di Rocco is joining our event since last 2 years. He attended the physical event which was held in Paris in 2019 as a workshop presenter.
Yes, I know that.
Yes, we have got a tremendous faith through workshop by sharing the physical experience under his hands. Dr.
Thank you so much.
Yes, director of the M.P.R. International School, as well as Vice President, International President, and founder of APS Phys International Association of Posturology at Switzerland. Thank you very much, sir. Looking forward to meet again next time if everything goes well in 2022.
And I hope we can meet together personally in the future. I hope I can come again to Dubai and to these nice things together, and we can touch by hand in the future. I hope.
Yes. Thank you very much, sir.